The holiday season is stressful for folks. People put a lot of pressure on themselves for what those times should be like. They have expectations around family events. And in some cases, it can be a time where people are reflecting on the entire year and they start to feel that perhaps they haven't lived up to those expectations or things aren't quite going the way that they had planned. And so then we have a lot of people contact us because they need more support at that time. People have historically thought that the end of the year is a time when we see an increase in self-harm, suicidality, people reaching out to our text line or our hotlines. But what we actually see is that there is a downturn during those times. And what we attribute that to is that people are traveling, they're not in those same social networks where they know how to access resources. And that's part of the reason that we're asking people to know that this is a resource that they can utilize and they can reach out to us, that this is a time when people should be focusing on their self-care. It absolutely helps folks to talk about what's going on. One of the biggest services that we can offer is just having someone be out there willing to listen to whatever a person's going through. A significant portion of the folks that contact us really just need to say what's affecting them and hear some ideas about what next steps could be. When somebody texts HOPE2FOR-HOPE, they're going to be connected to one of our crisis counselors. Those are individuals with behavioral health experience, so generally 4 to 5 years of work in the behavioral health field. And what they're going to be doing is they're going to be assessing a person for safety first, making sure that that person is safe, and then we're asking them what's going on. We're really trying to find out what is the reason that they've contacted us. The biggest thing we're going to be doing is listening to them and then helping them work through a plan on what they want to do next in terms of their care. In some circumstances, that could mean that we have the ability to send out a person to meet with them face-to-face, but the vast majority of the time, folks really just want to be heard and they need some support in finding the next resource that's going to get them to the treatment option that they're interested in. We try to make our services in terms of access to the public as general as possible. If anyone has any type of behavioral health issue that they need assistance with, we want them to contact us as early as possible. This isn't just a crisis line, this is a line for people to understand how to access behavioral health services. So if somebody wants to call us on behalf of another individual, they can do that and we can help them connect them to resources. So it really is a spectrum of care that we offer, all the way from making referrals to resources through helping people that are in acute suicidal crisis. You can contact Solari 24/7, 365 by texting HOPE2FOR-HOPE. You'll immediately get access to one of our clinicians. We want people to understand that whatever reason they're calling, we're here to help. There's always somebody that's willing to listen. And that can be anything from just a basic referral to services all the way through crisis assistance.